Welcome to Medical Specialists Associates Educational Series on Topics in Pain Medicine. I'm Christopher Voss, MD, MS, FCCP, Board Certified in Anesthesiology and Pain Medicine. Today we're focusing on cervical epidural steroid injections, or CESIs. If you suffer from chronic neck pain or radiating arm pain due to conditions like herniated discs or spinal stenosis, you might be considering a cervical epidural steroid injection as a treatment option. In this video, we'll explore what a cervical epidural steroid injection is, who might benefit from it, the likelihood of success, potential complications, and what outcomes you can expect. What is a cervical epidural steroid injection? A cervical epidural steroid injection involves administering a corticosteroid and a local anesthetic into the epidural space of the cervical spine, the neck region. The purpose of this injection is to reduce inflammation around the spinal nerves, which can help alleviate pain in the neck, shoulders, and arms. Clinical indications. When are CESIs recommended? CESIs are primarily recommended for managing pain associated with the following conditions. 1. Herniated or bulging discs. When a disc in the cervical spine protrudes and presses on nearby nerves, it can cause neck pain that radiates to the shoulders or arms, cervical radiculopathy. 2. Cervical spinal stenosis. A narrowing of the spinal canal in the neck that puts pressure on the spinal cord and nerves, leading to pain, numbness, or weakness in the arms. 3. Degenerative disc disease. Age-related changes in the cervical discs that cause pain from inflammation and nerve irritation. 4. Radiculopathy. Nerve pain that radiates from the cervical spine down the arms, often due to nerve compression or irritation. 5. Cervical spondylosis, wear and tear affecting the spinal discs in the neck, leading to chronic neck pain and stiffness. The procedure. What to expect? The procedure is typically performed on an outpatient basis and involves the following steps. 1. Preparation. You'll lie face down or on your side on an X-ray table. The skin over the injection site in your neck will be cleaned and numbed with a local anesthetic. 2. Injection. Using fluoroscopic X-ray guidance, the physician will insert a needle into the epidural space of your cervical spine. The corticosteroid medication, often combined with a local anesthetic, is then injected into this space. 3. Post-procedure. After the injection, you'll be monitored for a short time before being allowed to go home. You might experience temporary numbness or weakness in your arms, which usually resolves within a few hours. Probability of success and duration of relief. The effectiveness of CESIs can vary depending on the underlying condition and the severity of your symptoms. 1. Success rates. For conditions like herniated discs in the cervical spine, studies suggest that about 50 to 70% of patients experience significant pain relief. For cervical spinal stenosis, the success rate is somewhat lower, with approximately 40 to 60% of patients reporting improvement in pain and function. In cases of cervical radiculopathy or nerve root compression, around 60 to 75% of patients experience relief. 2. Duration of relief. Pain relief from a cervical epidural steroid injection can last from a few weeks to several months. On average, patients experience relief for about 3 to 6 months. Some patients may require repeat injections for sustained relief, while others may find sufficient relief after just one injection. Potential complications and risks. As with all medical procedures, cervical epidural steroid injections carry some risks, though serious complications are rare. Potential risks include 1. Short-term side effects. Temporary increase in pain at the injection site. Headache, particularly if the dura, a membrane around the spinal cord, is punctured, leading to a condition known as a dural puncture or spinal headache. Flushing or facial redness. Temporary numbness or weakness in the arms. 2. Long-term risks. Infection at the injection site. Rare, less than 1%. Bleeding, particularly in patients with bleeding disorders or those taking anticoagulants. Nerve damage or paralysis, extremely rare. Increased blood sugar levels, especially in diabetic patients. Osteoporosis or weakening of bones if steroids are used frequently. Spinal cord injury, extremely rare but serious. Expected outcomes and considerations. While CESIs can be very effective for managing pain, They are typically part of a broader treatment plan that may include physical therapy, medication, and lifestyle modifications. It's important to remember: 1. Individual variation. Not all patients will respond to CESIs in the same way. Some may experience significant relief, while others may have minimal or no improvement. 2. Temporary relief. CESIs are generally considered a temporary solution. If you achieve pain relief, it can be an opportunity to engage in physical therapy and other treatments that address the underlying causes of your pain. 3. Repeat injections. If you respond well to the first injection but the pain returns, your physician may recommend additional injections. However, there is a limit to how many steroid injections you can safely receive within a year due to the potential side effects of steroids. 4. Informed decision-making. Deciding whether a cervical epidural steroid injection is right for you should involve a thorough discussion with your physician. Together, you can weigh the potential benefits against the risks and consider your specific medical history and treatment goals. Cervical epidural steroid injections can be a valuable tool for managing chronic neck and arm pain, particularly in conditions like herniated discs and cervical spinal stenosis. Understanding the indications, potential benefits, and risks can help you make an informed decision about whether this treatment is right for you. To learn more about pain medicine, please visit us on our website at medspecialists.net and subscribe to our YouTube channel.